Thank you, Mr. Chairman. My name is Cristiano Gomes. I'll be presenting and replacing Dr. Sauler. These are my affiliations. This is the first cross-sectional population-based epidemiological study of Luts in Brazil. Our primary objective was to assess the prevalence and bother of Luts in the population aged older than 40 years in 5 major cities in Brazil. This study was conducted by a telephone survey from September to December 2015, and the participants rated how often they experienced individual Luts during the past month using a Likert scale, varying from none to almost always. We used 2 definitions of Luts. One was a broader definition with Likert scores 2 to 5, and another which is a more clinically relevant definition with Likert scores 3 to 5. There was a total of 5,184 study participants, 53% were women. In the second line, we can see the age distribution of the patient population, the population of the study. And to the left, using the definition 1, which is a broader definition, we see that almost 70% of men and 82% of women have some Luts, some kind of Luts. And to the right, we see that 40% of men and 60% of women have Luts based on a more clinically relevant definition. And we can see also the other types of Luts in the other bars. The prevalence of Luts increased with age based on the 2 definitions. And we use the IPSS definition of Luts. 83% of men and 84% of women have mild symptoms, and more than 20% of men and women have moderate to severe Luts. In terms of bother, we found a significant association between the frequency and bother intensity of each urinary symptoms, and we can see that the storage symptoms were those who presented more bother to both men and women. In conclusion, of the population aged more than 40 years old in Brazil, 75% have Luts less than half the time or more. 50% of those have Luts half the time or more. 84% of those have at least mild symptoms based on the IPSS definition of lower urinary tract symptoms. Symptoms are bothersome to most patients, and there is a statistically significant association between the frequency and bother intensity of each symptoms. These data are consistent with studies in Europe, North America, and Asia, and in Brazil, Luts are highly prevalent and associated with substantial bother. Thank you very much.
Thank you, Dr. Gomez. Any question from the floor, please? You want to ask him?
I have a question. Did you investigate how many participants in this study with any Luts had visited healthcare professionals for urinary symptoms?
Yeah, we're not presenting here, but that's a very good question. About 50% of the patients had seen a doctor for their symptoms, and about 1/3 of the patients had received treatment for the symptoms. Of those who had seen a doctor, 70% were happy with the improvement they have with the symptoms.
Good.
Okay.
Any question?
Thank you, Dr. Gomez.
Thank you very much.